Months of negotiations have finally resulted in a deal that turned a vacant Garland hospital into a new VA healthcare facility. The feds say long-term it'll create jobs and provide better service to veterans. In the short term, though, it could help be used as overflow for non-veterans and veterans alike in the pandemic. I spoke yesterday with Congressman Colin Allred, who is part of a group pushing for this deal, and I began by asking him if the pandemic added urgency to the negotiations.
Well, you're right. We have been working on this for over a while now. Last year, we sent a letter to try and move this along. It's something that had been stalled. And then I've had dozens of calls with Baylor Scott & White and the VA. A few months ago, we thought we were going to lose the project, and we were able to get to this final point. But as soon as we knew what was coming to the area in terms of coronavirus and its threat, it became part of our conversations that this could be part of the response to it. And so it absolutely was part of it. And I think it also was a bit of a stimulus in terms of getting it moving along, because we all recognize the capacity issues that our healthcare system could have.
So the VA is going to be operating this. Does that mean that the patients that are going to be there with COVID-19 are going to be veterans?
Well, initially, this is going to be to support our veterans, but it also will be a COVID-19 overflow location. So should our civilian hospitals be overrun, then we can activate the VA hospitals, and this will be part of that response as well. In the long run, it's going to be a fully functioning VA healthcare center that's going to allow us to serve over 184,000 veterans in the area. And it's a very big deal. It's a win for the city of Garland. It's going to create around 5,000 jobs. It's a win even for Baylor Scott & White, but most importantly, it's a win for our veterans.
So I know immediately there's going to be, or pretty soon within weeks, 100 beds or so. Can that be expanded upon and grow as well?
Well, I'm sure that the leadership at the Dallas VA will do whatever is necessary. We have great leadership there with Dr. Holt and his entire team. And the idea here is to make sure that if we are overrun in our hospital system, that the VA can backstop our civilian healthcare system. That is their fourth mission. And as a member of the Veterans Affairs Committee, that's something we've been preparing for as well. And I'm just really happy that we've been able to get this done in time before we see the spikes that the experts are saying may come later this month and even early next month.
I know that this was a bit of a bipartisan effort as well. How proud are you of everyone kind of coming together to make this happen?
Well, it has been. Our entire North Texas delegation has worked together to make sure that this happened. Of course, it's in my district, and we took the lead on pushing for that, but it wouldn't have happened without the support of our entire area here. And Ron Wright in particular, my colleague, I want to thank him for his work and joining me in this. This is what I think North Texans want to see us do, is work together and make sure we get things done. And really, this is the win for everybody, and it's not a partisan issue. It's the kind of thing that's just good for our area.
Do you know if when they do open this for some COVID beds, is it VA that's going to staff that facility and kind of run that?
Yeah, it's a VA health center now. This is the Garland VA Health Center, and it's going to be run by the VA, and it will have VA staff there, and they are excellent. They're very good at their job. I think we should all feel a lot of comfort that the VA health system will be backing up our local and civilian healthcare systems, because these are folks who are mission-oriented. Many of them are veterans themselves. They know how to carry out a task and get things done. What we've seen in some areas around the world is medical professionals who really don't have the training. They're dermatologists and other things being brought in to treat COVID patients. That's not going to happen here, because we'll be able to activate both our veterans and our military system if necessary.